On this episode of Clear the Air,
the population in the United States with the highest incidence of tooth decay is actually deployed soldiers. I didn't know that until they told me that. And so they said, well, if this works, then we can just put gum in their MREs and it'll work. And so they went out and they put it out to bid, and the company that made the gum for them made them a gum that wasn't 100% xylitol, and so it wasn't very effective. So they scrapped that program and said, well, it doesn't work. So then the government, rather than going back and re-examining all the studies that have been done on xylitol and why the gum that they had made didn't fit that, what they did is they went and spent millions and millions of dollars to develop combat gum. And it's called combat gum. But they made a gum that cost $2 per chiclet.
Wow.
Okay, $2 per chiclet.
That's expensive. Instead of us just getting the net result of more fentanyl, I think there was reportedly, already collected at the border enough fentanyl to completely decimate 2/3 of the U.S. population. 220 million deadly doses is what they've collected so far at the border.
It's a little sketchy. And the FTC was originally actually put out there to stop the sale of false, fake snake oil. You had unscrupulous people here in the U.S. that actually started making balms without snake oil.
Claiming that it had it in it.
Claiming that it had it in it. And so the real snake oil actually worked, but the fake snake oil didn't. And the FTC, their guidelines are to make sure that you are not making false or misleading statements. Hello, and welcome to Clear the Air podcast. I'm here with Joel Melton.
Hey everybody, good to be back again.
And we're now at number 2 in our 3-part episode of the opioid crisis and the government corruption and how it facilitated that crisis and other healthcare crises. So, anyways, we previously talked about the history of the opioid crisis and how government regulators and the Sackler family's involvement in the problem. And today we're going to take a little bit deeper look into how things in the opioid crisis are today. Have they gotten better? Have they gotten worse?
Yeah, I think that's interesting because even the words opioid crisis connotates something that happened a while ago, but it is still going. Sadly, things are not improving, and I think that's one of the biggest travesties here. Our government isn't doing much to benefit those who have been affected and stopping what's going in the future. So that's really a crazy commentary on that, and they call it an epidemic. Deaths from this drug overdoses is continually on the rise.
Yes. The first issue that I have with that is when our government calls something an epidemic or a pandemic, that just really means that they're never going to do anything about it except make it worse.
They can classify it in there and kind of forget about it, huh?
Find me an epidemic that our government has addressed that they've actually made better.
Right.
They've discussed about the silent pandemic or the silent epidemic, which is tooth decay. They started talking about that in the late 90s. In the 2000, the Surgeon General we've discussed this, put out a paper saying that the state of oral care in the U.S., oral hygiene in the U.S. was deteriorating rapidly. And if we didn't fix it, then, we would become a very sick nation, which we have become a very sick nation. And even back in 2000, they acknowledged that you can't be a healthy person if your mouth isn't healthy. And nothing's been done. I mean, it's just gotten worse. And even in 2021, you had Francis Collins, the head of the NIH, the organization that just said that Lucky Charms is healthier for you than a steak. But you had Francis Collins and the Surgeon General Vivek Murthy. I just love saying that name; it just rolls off my tongue. Vivek Murthy.
Sounds like it.
But they just put out another paper saying that it's horrible that the incidence of tooth decay is still declining, and they didn't actually suggest any solutions because we know there's a lot of solutions out there if they would just utilize the data we have. Really what they said is that we have to allocate billions of dollars, not to solve the problem, but to research how to solve the problem. And I think that's a huge problem. And that's part of what the issue is, in my opinion, with our government and our public health agencies. They start calling something and all they see is dollar signs because now they get to go and fund a whole bunch of research to try to figure out what it is and how to solve it. And I think that just needs to stop.
So it's the same process, right? Private sector has the answers or has solutions, but the government has to go research to make sure that they know what the private sector already knows, because I'm sure there are a lot of solutions like we have, like others have with the oral health care pandemic and other things, but just the craziness of trying to go through that.
Yeah, and I mean, and I don't believe that the opioid epidemic is any less today than it was 25 years ago, and I don't think that the COVID pandemic is any less today than it was 4 years ago. It's just now the media isn't talking about it. Mm-hmm. I think people are still getting sick. I still think they're getting hospitalized. I still think they're having waves of this. You see it in the news where they're still talking about it a little bit, but not in the glaring shut everything down and make a catastrophe of it like they did in 2020.
Yeah,
so
it seems like there's really only a time for government officials or bureaucrats to get involved when that's a personal passion or they have some tie into it. Otherwise, they're just out there like the oral health care pandemic or anything else. If it doesn't touch them personally, they address it but never delve into it, and they always have the excuse.
Yeah. So anyways, a great example of while you were just saying that, it came back into my mind is that, when we first started going out and talking about xylitol gum and the studies showing how xylitol gum can help prevent tooth decay, we were going to some of these dental conferences, and this is back in like early 2000, 2001, and we're talking to these dentists from the military, and they're like, "Oh, that sounds great," because the population in the United States with the highest incidence of tooth decay is actually deployed soldiers. I didn't know that until they told me that, and so they said, "Well, if this works, then we can just put gum in their MREs and it'll work." And so they went out and they put it out to bid. And the company that made the gum for them made them a gum that wasn't 100% xylitol, and so it wasn't very effective because the government just said, we want a gum with xylitol, not a gum made of 100% xylitol.
Yeah.
And so they scrapped that program and said, well, it doesn't work. So then the government, rather than going back and re-examining all the studies that have been done on xylitol and why the gum that they had made didn't fit that, what they did is they went and spent millions and millions of dollars, and they came up with, and you can look this up, okay? But they went out and they spent millions of dollars to develop combat gum, and it's called combat gum. And I'm trying to remember the data on this, and I have and I'll tell you the story why I have a lot of this data. But they spent, I want to say, it was millions, and I can't remember how much, but they made a gum that cost $2 per chiclet.
Wow.
Okay, $2 per chiclet.
That's expensive.
And and if you chew it 3 times a day for 10 minutes, it reduces tooth decay by about 70%, 80%. The reason why I know all this is because in about, I want to say 2015, I get a phone call from a group, and their job is tasked with taking military technology and selling it to the private sector. And they called me to try to sell this gum that cost $2 a chiclet. And I said, no one in their right mind, is going to pay $2 a chiclet, except the government, of course, to achieve something that a 5-cent chiclet will do just as effectively if you actually just get a 5-cent chiclet that's made with 100% xylitol.
Right.
And they got all mad at me and said, well, this works better. And I said, really? Show me the data. Because they didn't have enough data. Yeah. There's much more data showing that xylitol works. But anyways, that was
interesting.
That was just a quick story. But they didn't get mad at me, but I think they were, I think that they thought that I would be much more ecstatic about being able to take a chiclet of gum that I would have to pay $2 for, which means by the time you go through and put it on the grocery store shelf, each chiclet would probably cost $8 or $9.
So you'd have a $90 pack of gum you're selling at the checkout stand.
Pretty much. and so, the only people that pay that kind of money are governments.
That's not, in reality, that's not an impulse buy, which is what you want it to do. The government can impulse buy that, but the rest of the world, no.
So anyways, that was trying to have the government solve a problem.
Just gets more expensive.
And what was in the gum was actually just a bunch of enzymes. They sent me the list of it. It's been a while, since I looked into it, but I don't remember what exactly it was. But they didn't use xylitol. It was some enzymes that help change the microbiome in your mouth. So
the right thought, just too expensive.
yeah, ridiculously expensive.
Huh.
So anyways, let's get into this, because really what we want to do is figure out why is it that our public health agencies don't address epidemics and pandemics in responsible ways that actually solve the issue, as opposed to, just trying to cover it up. And again, we've brought this up many times, is that our government is suing us for trying to share studies, like the study that was done in India, where a xylitol nasal spray reduced transmission of COVID by, nearly 70%, and using one with iota-carrageenan. And if you can find one, then use it. But, the study that was done in Argentina, where they used iota-carrageenan 4 times a day, and it reduced transmission by 80%. So simple solutions to wide variety of hygiene solutions to a wide variety of illnesses is a better way to solve an epidemic or a pandemic than sitting around and trying to make a vaccine for each and every variation of an organism, of a pathogen.
I mean, I can understand that from economic perspective, from an entrepreneur perspective, from creating this thing, but it just seems ridiculous that we can't go back to the roots of something that's simple and use it. And, the acronym Keep It Simple, Stupid, KISS everything. Make sure that it's just simple, and don't have to complicate it, don't have to reinvent the wheel. But it seems like that's what happens all the time, and it just gets more expensive, like $90 for a packet of 10 chiclets of gum.
Yeah. I haven't seen Combat Gum on the market. I actually think there is a brand out there called Combat Gum, but it is not the same one. I think that's just a mouth-watering gum, but I'm not positive. So let's start discussing a couple of these statistics. We had them pull up a bunch of statistics on the opioid and the narcotics issue.
Yeah, so let's talk about the deaths reported in drug overdose.
Okay, do you want to read that, or do you want me to?
Yeah,
Because this is actually kind of crazy. I didn't realize that this is how many people every year are affected by this.
So how many deaths a year? It's crazy. Nearly 108,000 people a year in the U.S. die from drug-involved overdose, and that was in 2022. So it's on the rise, definitely. I just did the short calculations. That's 295 people a day. And if we divide that, 12 people an hour. So we're losing 12 people every hour to drug overdose in the U.S. And that's scary. Scary to think that the key to doing that drug overdose is often prescribed by a licensed physician.
You know what's scarier? Is that we're losing that many people a day, and our public health agencies are still being staffed by people that are staffing them.
Yeah.
I mean, this is the epitome of government ineptness. If you're losing 300 people a day, and the numbers continue to rise, wouldn't that tell you that the government public health agencies are not doing their job?
Right. In any other normal circumstance, that would be something through an audit, an immediate audit, they would find out. But here it just is a blind eye, and they continue to proceed as normal. It's absolutely crazy.
Dang. Okay, so how have things developed from 50 years until now? And what are 3 waves of the opioid overdose deaths? And we have a couple of graphs that they're going to put up here for you to see. But, it's kind of crazy. I'm just telling you. Let's go back and look at, let's say, 2015. There was 52,000 people that died from overdose. And in 2022, it was 107,000. So really in 7 years, it's doubled.
Yeah, I mean, they started it in 99, which was 20,000, and now we're at 108,000, so it's almost 6 times worse.
Yeah.
In a total of 20 years.
And looking at this one right here, U.S. overdose deaths, select drugs or drug categories, and they're looking at synthetic opioids, psychostimulants, cocaine, prescription opioids, benzodiazepines, heroin, and antidepressants. And you can see that in 2015, the overdoses attributed to synthetic opioids other than methadone and this is primarily fentanyl, are going through the roof.
They're climbing Mount Everest there. That just took a just went straight up.
Hey, there's a tiny little bump there in 2019.
Yeah, that's true.
Other than that, it's going straight up.
Yeah.
And that's actually a little sketchy. I mean, you see this in the news. Some of these conservative outlets are talking about it and asking why our government is allowing, all of these drugs to come in across the border. And I mean, why would our government want to stop it? I mean, we had the wars in China, the opium wars, because we wanted to make the Chinese use opium and heroin. So why isn't turnaround fair play? I mean, I think that the Chinese are just doing to us what we did to them 100 years ago.
Feeding the fentanyl in, right?
Yeah. We fought wars. I mean, the British were the bigger instigators, but we were the supporting actors in that. And we had the Delano family and the Cabot family, a bunch of the very prominent families in the U.S. were involved in the heroin and opium business and pushing that into China and pushing for these wars to be fought so that we could force the Chinese to buy the drugs that we were selling them. So now the Chinese are just, hey, turn around, it's fair play.
Turn around, it's fair play. Yeah, it's ridiculous, and I don't like it one bit, but I see the point here.
I mean, it's no different than I always laugh when people are sitting here and arguing about Russian interference in our election or Iranian influence in our election. I mean, why would we complain about that? Have we not been getting ourselves involved in pretty much every election on the planet?
Yeah.
I mean, I think our government has been involved in overturning countries and overturning and stacking elections in other countries for hundreds of years.
Yeah, nothing new about it.
So why would anybody be surprised if someone was trying to influence our election? It's like we're all being surprised. Ooh,
yeah.
Some other country's trying to influence our elections. Oh, no.
Well, it's because now we can all see it with social media. Before, it was hidden behind the doors of bureaucracy, right? They didn't.
Yeah, but we knew. I mean, that's what the CIA's been. That's been their job from day one, is to go over there and overturn other countries, and influence those elections. That just annoys me when people are like, "Well, why are they coming in here and influencing us?" Well, okay, because we went over there and overturned the government in Iran, and the Iranian people didn't like it that much. We did it in other countries. We've done it all over the world. So, of course, they're probably pissed at us.
Yeah.
I mean, we're pissed at them for trying to do it to us. I'm just really surprised that we're surprised.
that it's coming back, yeah.
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 So anyways.
Those three phases that you talked about, right? So 99 was the initial phase of the opioid where it started to see a big climb.
Yep.
Right, and then it went into 2010, and that's when heroin kind of saw a rise. And then it didn't last that long. In 2013, it was the synthetic opioids that really took at. So those three phases, within the last just over 24 or 25 years, we've seen this huge increase, which makes me not wonder why there's 295 deaths a day. It's just being pushed, and everywhere it's available, and because of the addictiveness of this and the necessity for some to think they need that, it just continues to go and rise. I hate to shudder to think what it'll be 10 years from now or even 3 years from now.
Well, I hope that is something that, when when Robert Kennedy gets in there, I wonder what he's going to do about it.
Yeah.
I mean, you got the media coming out and saying that he was a cocaine dealer when he was in college, 50 years ago. So, maybe he'll come, at least he's an insider now, and we can, have an insider in there working. Even
right.
Though I don't know if anybody's claiming. I mean, he in one of his interviews that he did, he talked about when he's kept in touch with somebody that he went to Alcoholics Anonymous with like 40 years ago, and he still keeps in touch with him and talks to him. So I don't know if he's been sober for 40 years, But
Yeah, I don't know either, but
at least he's been fighting his addictions for 40 years.
yeah, it sounds like it. And you listen to him talk. I listened the other day, kind of giving a layout of his lifestyle right now, and it seems pretty clean. I mean, he said he doesn't touch any processed foods, works out all the time. So you have to imagine that change. And if it's been 40 years, great, good on him. But that's quite a drastic difference if he was, heavily involved with all of that. And especially today on the rise, it's just got to be a terrible thing for anyone who's involved in addiction of it. So, but yeah, I think it's just hard to believe that we've had those 3 increases and more. And what does the future hold if we don't have someone like RFK get in there and really take care of it, as opposed to what sometimes happens is make up legislation that goes nowhere. It's packed with too many other things, and so.
Well, I don't think that more legislation. You can't legislate morality, and I think that the issues of drug use and drug abuse are more of a moral issue. I mean, it's a moral. I mean, I guess I'm the blind talking about the blind here, because I've never used an opioid or heroin or anything like that, and I don't plan on it unless anybody has some here. I'm kidding. No, I've seen how it ruins lives, and I have no interest in it. But obviously it's there, and obviously people are doing it. But I think more than anything else, I think we've got to figure out what is driving people to want to try these. And I think that's the question that's got to be solved.
Yeah.
Is why are people being driven to try these?
Well, it's reported that I like you, have never tried it. I stay away just because of the danger and the fear. But the opioids.
So you're saying you're afraid?
Yes.
Okay.
I'm deathly afraid. But the opioids are reportedly stronger than anything they're using now for end of life. If you talk about morphine, that's usually end of life type pain relief. When they're on hospice or in the hospital, even for an injury that's so great they just can't handle it. And opioids now are, the OxyContin is reportedly stronger than that. And so it has that hold on them. It blocks the sensors. It targets the area in their brain that's a reward center. They feel that, and it just goes and goes. I'm not pretending like I know and understand the mechanics of what happens, but somehow, if it's even in a legitimate circumstance with some injury, they go and get that to relieve the pain. They've started on a trail that, and I read something once that said if they continue to follow what the directions are on the pill bottle. Well, those 10 words on a pill bottle make no difference when you're in pain and you have that close by and you take it. Well, it starts affecting the physiological makeup of your brain. That's much stronger than, saying take one every 8 hours or something. So I think it's a tragedy with that and the strength of this, the opioids.
I agree with you, and it's depressing just looking at these graphs.
Yeah.
So
they're
let's
just on the rise.
cover up the graphs and get onto something much more exciting.
Yes.
And not quite so depressing.
So would legislation help with this in the border crossings or whatever?
I don't think so. I mean, I think it's illegal. So what legislation are you going to enact? The rules are already there. And it goes back to the studies, we have the knowledge, we have the studies, we know how to end tooth decay, we know how to curb respiratory illness and transmission. We have studies showing that. Going and doing more studies isn't going to solve the problem. We already have rules and laws saying don't bring fentanyl, don't bring heroin, don't bring these drugs into the country, don't use them. Going and making more laws isn't going to change that. I think it's getting out and teaching people and working with people and finding what's driving them to that and trying to fix that. I think I think a lot of it. Actually, I don't know that I could say that. I was going to say a lot of it is people that are growing up in single-parent households, but I know a lot of people that aren't, that are adamantly opposed to doing drugs that grew up in single-parent households.
Right.
And I know people who do drugs that grew up in loving households.
Sure.
Well, what I think were, I don't, obviously I didn't grow up with them. So I don't know the answer to that, but, I think that that's something that should be looked at. And, I think that peer pressure with kids, I think there's ways that they could do it. I mean, look at if they can get us to believe that steak is worse for me than Lucky Charms, they've got to find a way to be able to make me understand that drugs are bad for me.
Well, I think I've got a new plan. I'm going to make steak and potato flavored Lucky Charms. You think that would work?
I'm trying to think if that would even be nutritionally. If you can make them, I will.
You'll try it?
Yeah.
Okay. I'll work on that. I agree with you with what you said. I think that more legislation does not fix the problem. It's always that we have something on the books already, and it's the enforcement, the implementation, or the consciousness of that I think is always lacking. It's almost like whoever's in office or whoever's in that position creates some legislation or something to do, then they either leave and it doesn't get carried on, the legacy of it goes away, but it follows true with everything we look at. The legacy of those just waters down, and I think that's the case. Like you said, it's illegal now to bring it over. So why don't we take those 80,000 tax IRS agents that they were proposing and put those on the border, or go find where this is all happening and do that, and put the onus back on the countries where it's coming in from, instead of us just getting the net result of more fentanyl. I think there was reportedly, already collected at the border enough fentanyl to completely decimate 2/3 of the U.S. population. 220 million deadly doses is what they've collected so far at the border.
It's a little sketchy.
Yeah.
I might be putting it in my...
Your Lucky Charms.
We're going to get sued if you say it. Anyways, so, we now have... How have things developed over from 50 years until now, and what are the 3 waves of the opioids death? And you answered that question, but how many people are dying? We discussed it a little bit, but I want to dive into it from a different angle. But how many people are dying a year or a day from pharmaceuticals? We have that in a graph, and you said it, but yeah. I want to touch on that again to make a point about something.
Right. So it's 295. About 300 a day are dying.
So we have 300 people a day dying from pharmaceuticals, drugs use in this country. That's prescription and illicit, illegal. So how many people a day die from supplements, from taking vitamin C or vitamin D or, some zinc or something like that?
That would be interesting to find out. My guess is it's negligible because there's probably not even any research on it. It would be in conjunction with something else, but I would say very, very low. If there's any numbers, it's got to be not even 1 a day.
So you have people in the media, because I see this all the time, that are coming out and claiming, and I'm going to say that they're probably pharmaceutical plants, that the natural medicine industry needs to be better regulated, but yet the pharmaceutical agencies that are regulated by the government are killing 300 people a day. So tell me, I just want to try to understand, how is it that if you have an industry that's not regulated and they're not killing people, and you have one that is heavily regulated and they're killing 300 people a day, I mean, do we need to make it so that the supplements are killing people to make them better?
Right.
I don't understand the logic behind people going out and saying supplements need to be regulated. The supplement industry is regulated. You have to know what's in it. The FTC just doesn't do its job. They're too busy suing companies like us on frivolous things that we have studies backing up. And the FTC was originally actually put out there to stop the sale of false, fake snake oil. Because there was, and I can't remember it exactly, but there was some kind of a liniment, lotion, and it was a Chinese herbal thing, and they would put snake oil of some type of a snake into it, and it worked because people were using it, and you had unscrupulous people here in the U.S. that actually started making balms without snake oil.
Claiming that it had it in it.
Mm-hmm. And so the real snake oil actually worked, but the fake snake oil didn't. And the FTC, their guidelines are to make sure that you are not making false or misleading statements. So what's going on is they're not doing their job, because they should be going after companies and saying, hey, You say you have vitamin C in here, but we're not finding any. You say you have this in here. I mean, a perfect example is you know, I'm not going to say who it is, but it's a company in our industry. And 20 years ago, 25 years ago, when we first started Clear, there was a company in our industry who copied our nasal spray, violated our patent. We had we filed an action against them. We were negotiating it, and they came back and said, well, the word xylitol is what's selling, so we're going to use this. We're just going to find a way around your patent. And so they actually put a nasal spray on the market, and it's still on the market today, and they say it's activated nasal mist with xylitol. We've tested it over the years. There's no testable level of xylitol in there. But right on the front label, it says activated nasal mist with xylitol. The FTC, that's the kind of fraud that they're trying to do. Maybe there is xylitol in it, but we used to. I mean, our patent's over now, and so we don't do it anymore. But we used to, every couple of years, we would go buy a bottle of it and test it. Never any testable amount in there.
Wow.
But on the front of the label, it says activated nasal mist with xylitol. So if the FTC was trying to get people to stop from making false and misleading statements, they'd go into the health food store, buy one of everything, test it, and make sure that what's in the label, what's in the bottle or what's labeled on the bottle is in the bottle. And that's the easiest thing for them to do, because they're trying to go out and make you substantiate the effectiveness of vitamin C, or the effectiveness of washing your hands, or the effectiveness of washing your nose, which that isn't what supplements do. We know what vitamin C does. It's, you know, there's a long laundry list of things that vitamin C does. You know, so the FTC is just going bonkers in overreach, you know, trying to shut down the natural products industry because we're not killing people.
Right. So they're going after those who are in compliance and making it harder for them to do stuff like making the randomized controlled studies, RCTs, 2 of them. Meanwhile, those who are not abiding by the legislation or any of the rules can still do it because they're not afraid to do it now. They make more rules, and it just hinders those who are doing it regularly. It sounds like a pattern that's applied in many aspects.
Yeah, if the FTC just did their job, they could root out a lot of the bad actors, but they're choosing not to.
So legislate more and hope that squeezes them out. It never works.
Yeah, legislation is you can't legislate morality, not even to the people in the government.
Yeah, that's exactly right, because they're just doing their job. That's what you'll hear from them.
Yeah, but they just can't figure out what their job is.
That keeps on changing.
That you know, I think who was it that just said, you know, you need to defund the UN because most of the people that work for the United Nations are just sitting around collecting a paycheck and not really doing anything. Well, the guys at the FTC are kind of doing the same thing. I mean, you know, let's not divert from this, but, you know, when we were deposing them, they're like, yeah, we didn't read the studies. We don't care. Yeah. It wasn't in the news, so we figured it couldn't be true. So, you know, we went and spent $10 million of the government's money trying to sue you. But yeah, we don't have any studies.
I'd like to see the job description.
Job description is to sit around and watch TV.
And collect a paycheck. Well, we talked about a little bit about this. There's some other details here that I think are important. The fentanyl that was seized by the DEA in 2024. And that's incredible. So more than 80 million fentanyl laced fake pills and nearly 12,000 pounds of fentanyl powder. That's incredible to think that much.
That's 390 million lethal doses of fentanyl.
Yeah, so that's even more than I suggested earlier.
Well, no, you mentioned the 2024, which is 227 million already.
Already, yeah. So that's true. Yeah, good point.
My question is, I'm trying to understand the inventory here, because if they're smuggling in 390 million lethal doses and that many got picked up, how many made it in?
Right.
But where is all this stuff getting stored that, I mean, why don't we have 300 million people dying? We have 300 people dying a day. But my question is, where's it all getting stored? Yeah. What are they going to do? Like, wait until someone sneezes or tells them, and then they're going to just go blow it in the air and we're all going to die?
Right. It's in the job description.
Where are they putting all this fentanyl? I mean, the numbers there That's something right there just doesn't add up now that I think about it.
Yeah.
If they're saying that they confiscated, either they're doing a phenomenal job of confiscating all of it, or somebody is building up quite the arsenal of fentanyl
That's making it through.
Yeah.
You're saying. Yeah. So I imagine, or I wonder what the percentage of that they're seizing then is the
let's
total,
say they're getting half of it. So if they confiscated 390 million doses, and let's say half, okay, let's even say they got 2/3 of it. That's still 150 million lethal doses. How many people are using fentanyl that we're only losing? I mean, and that's not, I'm not saying that in a bad way.
Right.
But it's only killing 300 people a day.
You'd think
I mean,
the numbers would be greater if that's half that's getting seized.
Or I'm thinking is that someone's building up a stockpile. I just don't know what they're going to do with the stockpile, but that makes me, I'm going to actually dig into that. I got to figure that one out.
Yeah. Yeah, for sure.
That is a little sketch. Now I'm sitting here worried about that. So, anyways, and what actions is the government taking to control this kind of stuff? Because that's interesting.
Yeah, it's interesting here because they take the role here of pity on the user instead of giving them good help. I mean, Portland decriminalized drug possession to allocate funds to treatment and rehab. And okay, I get it. They want to show some measure of kindness to try to get them. We know that doesn't work. It doesn't work by just being, less strict on that. The rules are the rules. Leave them there. But now they're decriminalizing it, and so there's moving away any barrier to get into that behavior.
I'm trying to think if how they're doing it, how Portland did it differently, because I know they recriminalized it. But, you go to some of these countries in Europe, and they decriminalize it, and they've had it decriminalized for decades. But I know that they really push rehab, and they do a lot of I'm trying to remember, because when I've been over in some of these countries, you see a lot of advertising pushing people to go in for rehab or for treatment if they feel like they're addicted to something. So I wonder, we should actually look at that and do another podcast on that in the future.
Yeah, I mean, rehab, what are they? I don't know the actual numbers, but they say that, you've got the people that go into rehab usually have to do it a number of times for it to actually take effect. And I get it, because they're going in a lot of times cold turkey. They're doing that and trying to get rid of that, and then they go right back into the environment that they had before. Nothing's changed, and it's easy to go back to that, I'm assuming. But even with recriminalizing it, I think that the missing the mark and not focusing on the aftermath of the rehab and getting them there to strengthen them, as opposed to just wanting to sweep it under the rug and put the problem away. The individual is what seems to be the least important, but that should be the most important.
Yeah. Well, I agree with that. And, we already discussed where most of these drugs are coming from. A lot of them are coming from China. They're coming through the Mexican border, which is wide open. But they could come through any border. I mean, I think borders in general are fairly porous. I mean, I don't know. I mean, the hardest border that I've ever seen was, I've done a little bit of traveling, but I've driven through countries in Latin America where there's nobody at the border. You can just drive right through. I've driven through borders, and not lately I haven't, but it used to be able to drive across into Canada and no one would ever stop you. You just drive right through.
Yeah.
The southern border, they've got a lot of check stops, but that's if you're staying on the road.
Yeah. Well, I think that's the tragedy, right?
Yeah.
You look at this, and they've already figured out the numbers. So if we're capturing, let's say, 50%, they already know the margin that they need, and so they're producing double that because they know half of it's going to get caught, so the rest of it will get through in the other porous areas.
We're going to do another podcast on this because I want to understand where all this fentanyl is going.
Yeah.
Because I think there's way more of it in the country than we know. And I heard somewhere, it's jogging in my brain, that somebody once said they were going to pour it into our water supply, and that would be kind of terrible.
Yeah.
But anyways, I think that's it for our second episode of our opioid epidemic and corruption in government, and how the corruption in government actually instigates and propagates epidemics and pandemics. And we'll come back with a third episode.
Yeah. Sounds good. Too bad.
So, thank you, and we'll see you again later.
See you later.
This episode was hosted by Nathan Jones, co-hosted by Joel Melton, produced by David Monk. Associate producer, Matthew Davis. Video and audio were edited by Caleb Scoresby. Research by Sabre Bills. Graphics by Joseph Thornton. Music by Augusto Diniz. If you enjoyed this episode of Clear the Air, be sure to follow, like, and subscribe so you don't miss out on the latest episode. Have a favorite episode? Share it with a friend or on social media. New episodes of Clear the Air are published weekly on YouTube, Spotify, Apple Podcasts, or wherever you listen to your podcasts. Thanks for listening. We'll catch you next time.